I don't want to share my video. I look really rough.
You don't have to. We encourage, but we're not peer pressuring you.
Okay, I feel like I need to fix my hair and take off my extra hoodie for being cheap and not turning the heating on.
No. No.
Oh,
Don't be
that's
cold on our
environmental
behalf.
friendly.
Exactly.
Okay, actually, that's not too bad. Hopefully, it's a bit blurry. It's nice to see all your faces, though, although I'm missing your baby, Max.
Well, we want to miss him for a while.
Well, yeah, we don't know. We don't know if he'll come the same way he did last time.
It's 6 in the morning for Max. Let's see, how many, are we ready to get started?
Let's
Solom?
see. Yeah, I think we have a fair few, so I think I'll just start. It's just so everybody knows, it is recording, so just FYI. Good morning, hello and welcome. Oh, sorry, I'm actually going to turn off my camera.
Oh, Salome, can I just quickly check? You're going to be moving through the slides from your computer, right?
I
So I don't
will.
need to share screen.
Exactly.
Okay.
I'm just gonna change slide decks once
Brilliant.
they're done. Is that okay?
Yeah, no, that's great.
Okay, wonderful. Okay, so hello and welcome everyone to the February 2020 School Health and Nutrition webinar. I am your new host, Salome Asers from Save the Children. It's nice to meet all of you. A brief introduction about us. FRESH is an interagency partnership for school health and development in low and middle income contexts. As a community of researchers, practitioners, and policymakers in education and health, we host webinars every month on topics related to children's health and well-being. This month, we are celebrating the International Day of Education, which celebrated its second year on January 24th, a day proclaimed by the UN General Assembly to honor education and its centrality to human well-being and sustainable development. The theme this year is Learning for People, Planet, Prosperity, and Peace, which aims to highlight the many ways learning can empower people, preserve the planet, build shared prosperity, and foster peace. This year's celebration framed this theme around the SDG 4, which, as you know, is inclusive and equitable quality education and lifelong learning for all. And it as a goal and a means to accelerate the progress to meet all the targets of SDGs through its integrated nature. It has a fundamental right and its centrality to our collective development ambitions. As such, we are focusing our attention to the topic of the barriers to school attendance and solutions to better understand the reasons so that we can mitigate and address these challenges. The most recent reports on the SDG 4 shows that while enrollment rates in primary education in developing countries has reached about 91%, still 57 million primary age children still remain out of school. Today, we will look at addressing the challenge of school attendance from a technology standpoint with a presentation of the Waliku project, as it was piloted in Indonesia, and a unique tool that was piloted in the humanitarian setting. Just to introduce our speakers, our first speaker is Mohini Venkatesh, and she serves as the Senior Advisor in the School Health and Nutrition Team in the Department of Education and Child Protection here at Save the Children US. Mohini leads Waliku project team and has worked closely with Max, her co-host, and the Save the Children team and the government in Sumba Barat, Indonesia since 2017. Outside of this project, Mohini supports other countries in Asia and Africa, as well as the wider global community in school health. She holds a master's in infectious disease control from the London School of Hygiene and Tropical Medicine. Welcome, Mohini. Our second presenter is Max Ritzenberg, and he serves as serving as an advisor on the Waliku project here at Save the Children. He is a physician working clinically and teaching on the faculty of the Department of Emergency Medicine at UC San Francisco, where he is also a faculty affiliate at the Institute for Global Health Sciences. Max has focused his non-clinical work on school-based health and continues to do this work through Waliku. And our third and last speaker is Catherine Cooper. She serves as education advisor at Save the Children UK, working at Save the Children for about 6 years, focusing on meal, non-formal education, and teacher professional development. She holds a master's in international development from University of Bath. Welcome to all of our presenters and all of our attendees. A gentle reminder, just to keep yourselves on mute. I'll do my best to monitor it as well. And if you have any questions during the presentation, please add them in the chat box. I'll monitor them and we will go through them towards the end when we have discussion. Thank you again for everyone, and we'll just start. Mohini, let me know when to press through.
Thank you. Thanks, Salome, and thanks for that introduction to the webinar and to all of us. And just to take off from where you left on the topic of the theme for International Education Day and inclusive education. This presentation on Waliku is about inclusive education and trying to meet the barriers to attendance and well-being of children in order to meet Sustainable Development Goal 4 and 4.1 specifically within that. We'll be presenting on the proof of concept, implementation, and evaluation of Waliku in its first year in the 2018-19 academic year. And before we do that, next slide.
Oops. There you go.
We'll talk about the rationale for why we developed this solution before we talk a little bit about the solution itself and its use case in Sumba Barat. Then I'll hand it over to my colleague Max, who will talk through the evaluation methods and results. And then we'll come back. Max will speak to the immediate next steps we're taking in our second year of implementing Waliku. And I'll talk more about the long-term strategic next steps for the work that we're doing. Next slide. So what is Waliku? Waliku aims to address absenteeism and the gaps in well-being of school-age children in low-resource contexts with the strategic use of technology. Why? Next slide. So we know from global literature on education that despite high enrollments in schools, student absenteeism continues to be a problem, not only in low resource contexts, but also in high income communities. Aggregated attendance rates tracked by school systems mask the extent of absenteeism at an individual level, which can easily exceed 10% of the school days or over a month of schooling during an academic year for over 40% of the student population. Student absenteeism in itself is a marker for some threat to the well-being of the students. Besides that fact, they're also losing out on learning, and they risk performing poorly over time. Chronic absentees are 3 times at greater risk than other kids of dropping out of school. Combined with this problem of absenteeism, which is not well recognized, is the fact that we use paper-based systems for taking attendance and responding to absences, and therefore the detection of absences and the reasons are late and insufficient, meaning that we, as school teachers, as schools, are not able to respond in a timely manner to counsel a child or the child's parents, remediate with necessary education or other support if there is a health or social threat, and refer the child if the child needs more support on any of those areas. While school-age children generally have better health than their peers who are under 5 years of age, they do suffer from preventable illnesses of high morbidity and mortality, such as diarrhea, malaria, intestinal worms, malnutrition, and there are other barriers to their participation and well-being in schools. So all of this puts kids at a great threat of their education and well-being, and underpinning these barriers is the limited communication that we see between schools and parents and communities in low resource contexts, the schools and the education system, and the school and other service providers, be they health, child welfare, etc. Next slide. So while we have these barriers, we know that technology can be leveraged to address these barriers. And it can be anything from a simple task of digitizing teacher and administrator attendance and absence management tasks. The solutions that are available are simple adaptations of analog systems, and we'll hear about that from Catherine in a bit, to out-of-the-box solutions from solutions like Kobo, ODK, Rapid Pro is another out-of-the-box solution. And then we have customized solutions that can be used to gather more real-time two-way management of data so that schools can respond um, as close to real time as possible. And the international community of NGOs and governments have in recent years developed principles for digital development, which help those of us working in development to really create solutions, technology-based solutions that are grounded in user needs, understanding the ecosystem, designing for scale, building for sustainability, being data-driven, ensuring privacy and security, open standards, and being collaborative. Next slide. And with that, I mean, Waliku is, or My Guardian as it is called in Indonesian, it means My Guardian in Indonesian, operates on the principles of digital development and on the principle that every child has the right to attend school and to achieve their fullest potential. Being very student-centric in its approach to addressing barriers to attendance and well-being, it's not only a technology solution, but an implementation system that recognizes absences and threats to student well-being, takes appropriate action, and does that with the objective of improving attendance over time and student well-being, so that they continue to survive through the education system. Uh, Besides the technology and solution, we are also a team of professionals in education, health, and child protection. And our solution, technology, and implementation is built to withstand the challenges of a remote, resource-limited context and other challenging contexts. Next slide. So what is the ecosystem? It includes children at the heart of the community, parents most closely attached to children, the schools, and school districts, and the government, as well as the other service providers. The first connection that Waliku makes is with that student parent school interface, and the next stage of strengthening linkages with community service providers happens after this um, first level of connections between different stakeholders, duty bearers, and students is strengthened. Next slide. So what is the theory of change for the school parent-child interface? One, that through digitized recording of daily attendance and absence reason, we have dynamic absenteeism data. Once the reasons for absence are understood, a school, depending on the absenteeism rate, can take preventive efforts to improving attendance and well-being, or where there is uh, where children are absent for more than 10% of the days. In other words, they're chronically absent or severely chronically absent when they're absent for over 20% of the days. An assessment follows, and those who need counseling are provided counseling then and there, while those who appear as red flags are immediately flagged for referral support from community service providers. So that's the theory of change at the school level. At the community links level, next slide. it really depends on what the context is in each community. In some communities, the community, there is a community worker who visits households and is able to provide immediate support to very sick kids or to very absent kids due to other reasons. In other communities, it's the role of the teacher to make that connection with the family and refer them to the service provider, nearest service provider. In the case of our proof of concept, it was the latter, where the teacher would reach out to the parents, identify um, of kids who've been absent for 3 or more days. If they were identified to be very absent and seriously absent, they would recommend they visit the local health center or a child welfare service provider. Next slide. So the use cases for Waliku are several. The one we're going to be talking about is the remote rural context with limited access to service points. But there are marginalized children and groups in urban communities where there are a large number of underserved children. There are locations with high disparities between children on the basis of gender, ethnicity, socioeconomic disparities. There are refugee contexts as well. These other contexts, we have yet to test the Waliku solution. Next. And there are other use cases. Waliku can also be used as a monitoring tool besides identifying kids who are most vulnerable. In the former use cases, here it is to know whether a school intervention has worked, whether a school safety program has improved the attendance of um, the children who were most targeted by that intervention or the whole school community, whether a school meals program is leading to the attendance levels that it expects, an inclusive education program for whatever element of inclusive education it's looking at is improving the attendance of children with disabilities or any other school health intervention. Next slide. And so the Sumba Bharat use case, I've talked about um, the reasons for why we chose this location. It was the high absenteeism, morbidity and mortality due to falciparum malaria and diarrheal illness that we saw. And following a feasibility study in 2017, we implemented the Waliku solution. Next slide. And what was it in this case? It was Android application, a mobile app for teachers to take daily attendance and track absences. They have an absence, there's an attendance taking icon to the left and absence task list icon to the right. In addition to that, because of many sick kids in school, we had a first aid tool for them to refer to in the first year. And it was online mostly as a application and limited offline features, but now it has both functionalities and is on Google Play Store as a beta. Next slide. The web application include, and this is for school administrators, includes tasks like setting up an academic calendar, holiday list, users, which are teachers, students in classes, assigning teachers to classes, and doing all the management functions, and also having a report section to look at daily, monthly, and year-to-date dashboard summaries. The same dashboards are also available for teachers. Next slide. So we implemented Waliku in 48 classrooms across 5 schools, reaching 1,200, just over 1,200 kids. And we engaged the 3 main stakeholders, teachers, parents, and students throughout the implementation. Next slide. I'll hand it over to Max.
Thank you, Mohini. So with that introduction, we wanted to evaluate Waliku in several different ways in order to understand the potential impact of the Waliku system on a school, on a community, on the various stakeholders and users of the system. And therefore, we put out three main goals and questions that we asked of the system in the proof of concept year. We use three broad categories: usage, accuracy, and utility. Usage we defined as the adoption and continued use of the system, asking the question of the system of what was the usage of the Waliku system for daily attendance recording and absence follow-up. And then in addition to the quantitative evaluation of the Waliku system, we pursued a qualitative assessment as well to understand what were teacher and administrators' opinions about the Waliku as a system for attendance recording and absence follow-up. We looked at the accuracy of the Waliku system versus a paper-based system, the traditional paper-based system, asking of the system what is the accuracy of the Waliku system when we're comparing it to that traditional paper-based system. Of our users, we asked teachers, administrators, opinions on how they view the accuracy of the data that was being produced by the Waliku system. And finally, we asked of the system what was the utility, both in terms of whether it has an impact on the community, the schools, the stakeholders, and of course the children, as well as what did we learn from the proof of concept year of Waliku in terms of the data that Waliku is actually outputting in terms of absenteeism, and then finally, along the same vein, qualitatively, we asked teachers and parents on feedback of the information that was being obtained and output through the Waliku system to the community and to the schools. Next slide. As Mohini mentioned, we used a phased-in approach for the system, introducing it in 2 schools for the entire school year, and then 2 additional schools mid-school year, and then our final school in February. February through May, we were collecting the more robust absence reason data, in addition to the attendance kind of present or absence data. This was then compared with paper-based attendance, which was taken the year prior to the proof of concept year, as well as the year that we implemented Waliku in the proof of concept schools. That was used as a gold standard for which we compared some of the data coming back on the Waliku system. Next slide. Our qualitative data came in a few different forms. With the teachers, we held focus groups with teachers in all 5 of our schools before and after the implementation of the Waliku system at each school. Additionally, prior to the training of each school, the teachers in each school, the teachers used a Kobo Toolbox survey that we designed to assess their understanding and use of attendance data compared pre and post introduction of the Waliku system. We used a semi-structured interview format to interview principals and IT operators. We also performed after with our parents, as well as a focus group with the students that were receiving the intervention. Next slide. Even off the bat, we knew there were some significant considerations, and then throughout the course of the year, even prior to collecting all of our data, we knew that there were some to our data collection and that would impact our analysis. These include some loss of paper-based attendance and some of the challenges related to that. Of course, this is one of the reasons for the introduction of the Waliku system is more stability of our data and the data that the schools are having access to. In addition, The paper-based attendance that we used were photographs of the of paper-based attendance that the teachers, homeroom teachers and non-homeroom teachers were taking. And one of the difficulties with that was transcribing from those paper-based sheets that included breaking down by gender, breaking down by individual student, which we did not do. So all the paper-based data new and continued to run into issues related to the calendar, which I'll talk about later, as well as systems issues with respect to technology and implementation. And therefore, as I'll talk about when we look at the attendance reporting days, issues significantly impact data in our analyses. And then lastly, we had started to brainstorm ways to allow the system to compensate for substitute teachers when the teacher doesn't attend for a specific day, and that process is still evolving. And therefore, when a teacher was not present for a specific day, attendance wasn't taken, and therefore that impacts how we look at the individual student data.
Max, you're kind of going a little in and out.
Oh, I am? Oh.
Yeah, it's okay.
Let's see.
I just want to make sure that we're not losing too much data. I think Mohini's also listening, so if we do, I'm sure she'll chime in, but I just wanted to let you know. Okay, did you say good. Next slide?
Yes, thank you.
Okay, no problem.
If it continues to become an issue, Mohini can take over. She knows this information very well. So as I mentioned, we looked at 3 broad categories to evaluate our data. The first was usage. We wanted to look at both continued use, adoption, as well as continued use of the system. Adoption was 100% across all 5 schools. 48 of our 48 teachers adopted and began using our more pertinent continued use of the WALIKU system, which we evaluated in 2 ways. One, we looked at the continued attendance reporting rate of using WALIKU, and then what the rate of absence follow-up was on the WALIKU system. As I mentioned, some of the challenges related to this and the calculation of this was how we define the denominator in these the calculi, partially because of the if our system wasn't recording holidays, it made it challenging to assess whether attendance wasn't taken because it was a school holiday or an individual class exam day, or whether attendance wasn't taken for some other reason. Next slide. Next slide. Thank you. The first metric we used to look at usage of the WALIKU system was the attendance reporting rate. Continued use can be evaluated in a number of different ways, and no way of evaluating the ongoing use was perfect. So we looked at it in several different ways, and ultimately we looked for basically we made the presumption of if less than 50% of teachers took attendance on a specific day, it was felt that it was possible that attendance wasn't taken that day by specific teachers because there was something beyond a teacher's motivation or a teacher remembering to take attendance, and that the possibility was greater that they weren't taking attendance related to either a system failure or an issue related to the internet access or access to their phones or data credit. And so we adjusted our calculus based on that to look at both attendance reporting rate as an absolute number, and then also attendance reporting rate for those days when more than 50% of teachers took attendance. And so, for example, the lowest month you can see is January, when all 5 schools had issues with phone and data credit. And And even just taking away January, which we knew we had issues from a system standpoint, the average monthly attendance rate for the 5 schools was up to 52 to 89%, and that's up from 44 to 69% if we include January, as an example. Without the no attendance days, to include for potentially school closed days and days with school-wide technology implementation issues, our attendance reporting rate for the 10 months was 68% across all 5 schools. For days when at least half the classrooms took attendance on Waliku, which indicated that there was neither a significant technology nor implementation issue in the school, that brought our average attendance rate to 87% across all schools for the 10 months that we were doing the pilot. So in addition to assessing usage based on attendance reporting rate and use of the attendance part of the system, we defined usage as well of what the rates were for absence follow-up. This was measured between February and May of 2019, where over 6,000 absences were identified by the Waliku system. Of these, teachers responded to 63% of absence notifications on the Waliku app, meaning that they went into the absence section of the app and actually recorded either a reason for the absence or that they had acknowledged the absence and were unable to report the reason for the absence. That accounted for 63% of the absence notifications on the Waliku app. And then 43% of absence notifications were responded to with either a health or a non-health reason. This was compared to our baseline academic year, the year prior to the proof of concept year, where we looked at 5 months as well. And out of 11,000 absences, teachers recorded only 15% of absences with a reason. So you can see a significant uptick in the number of absences that were followed up using the Waliku system. Next slide. The teacher opinions were elicited on the ease of use, the challenges with use, and opportunities for improvement. Ease of use, 81% of teachers reported the mobile app as easy to use, and 78% found the recapitulation of the attendance for reporting reasons were made easy by the Waliku system. They noted the same challenges to use that many did, including us throughout the school year, which was access to phone data credit, cellular data access challenges, and issues with updating attendance after submitting the attendance and i.e. correcting for students that arrived late, which all became opportunities for improvement for the next version. Next slide. We asked administrators, the IT operators, and principals of the schools for their opinions on the usage of the system, and 100% reported both mobile and web apps were easy to navigate. All of the operators found Waliku helpful to very helpful to tracking students, and we received 100% positive responses to using Waliku in the coming year. We found basically the same challenges with use and opportunities for improvement, which were similar to what the teachers reported. And also the IT operators and principals saw an opportunity for connection with the national database of students, which is called the DAPODIC, also improving the connection with health clinics. Next slide. The next broad accuracy system to record absence of students. We felt that that looking at the absences collected by the system as compared to paper-based system could best evaluate the accuracy of our of the Waliku application. Next slide. For the month of September, which was where attendance reporting rates on paper and Waliku were 100%, and therefore the number was not impacted by the report that Waliku counts than the paper-based, with a difference of 1.4% positive difference in favor of Waliku. Even when we, next slide, even when we looked at months where only greater than 80% of absences of attendance was taken, 80% of classes reported attendance, we found that August found a positive difference than the paper. Exception was December, where 11% more absences were counted by the paper-based system.
I'm
Next
sorry,
slide.
Max. Actually, could you do this slide again? You cut out a couple times.
Mohini, do you want to take over if I keep cutting out? So
I think you're doing fine, Max, just for the slide, but just to, I think what he was trying to say is just that even on the months where there was 80% or more attendance taken across classrooms, both for paper and for Waliku, 3 out of the 4 months, Waliku counted more absentees than the paper-based system. Max, back to you.
Okay, next slide. This was mirrored in the teacher opinions on the accuracy of the Waliku system, all of whom found that it recorded absence information accurately at least most of the time. Next slide. Nearly all the principals and all the IT operators believed the accuracy of this system and trusted the data and had a high confidence in the data output from the system itself. Next slide. Lastly, we looked at the utility of the system. That included 4 metrics: the absenteeism rate, chronic absenteeism rate, the leading reasons for absenteeism, and who was the informer of absenteeism when a home visit was performed or when absence reasons was reported in some way. Next slide. And then next slide. This is from 2 of our schools, the aggregated absenteeism rate, I'm sorry, for all 5 of our schools, the aggregated absenteeism rate for boys and girls over the 10 months that, that Waliku was in some and then all of the schools. We found an aggregated absenteeism rate of 11.1%, broke it down by gender, with an overall aggregated absenteeism rate for boys of 13% and girls for 9.2%. Next slide. In addition to overall absenteeism, one of the kind of hidden metrics within the absenteeism issue is chronic absenteeism. And so we broke down our evaluation as well by chronic absenteeism in one of the schools. Looking at the total student rate, 30% of the total students were found to be chronically absent, meaning they had missed over 10% of school days in the academic year. This accounts for an entire month of school days missed by nearly 2/5 of the student population. And then 8% of students had missed over 48 days of schooling, which is our criteria that we use for severely chronically absent. Next slide. Of the 2,400 known absence reasons that were evaluated during February through May in all 5 of our schools, you can see the Waliku system broke down by health and non-health reasons, what were leading causes of absenteeism when they were known. As you can see, other accounted for 844. There's a free text box where teachers could write in. Unfortunately, most of them did not include a write-in reason. And we see the first reason that we know of specifically is headache and cough, which accounted for over 700 of absences during that time period. Next slide. Of those 2,400 absences that were known, we looked at who in the application, it asked who was reporting the information. We can see that the students themselves, as well as peers, accounted for the majority of the reporting, which impacts our thought process on how we incorporate this data, as well as how we look at how obtaining the data in future versions of the application. We got next slide. We elicited additional feedback on the utility from the teachers, as well as parents and school administrators, both before and after the implementation. Next slide. This informed our immediate and long-term next steps for the Waliku system. Next slide. And next slide. For immediate next steps and the current version that we're working on rolling out in schools, based on feedback and our evaluation of the WellEco system quantitatively and qualitatively, we're working to improve the user interface with simpler absence follow-up screens, simpler first aid features, and improved dashboards. We're increasing usage by reducing frustration, partially through improved offline lose data on those offline days, building notifications and automating notifications so that teachers remember to take attendance daily without significant input from the school IT operators having to go from classroom to classroom to remind teachers. Improved coaching and mentoring, recognizing, encouraging, and motivating teachers with with more gamification of the system, and then ongoing technology updates that automatically sync with the phones. Mohini, you want to take the last couple slides?
Sure, sure. And I think the last, and I know that we're running out of time, so, and I'm conscious that Catherine has her slides to present too. So very briefly, just on implementation. And Max, have you covered that, the implementation? I think yes. And the strategic next steps, the next slide after this, Salome, and the next slide. So for the long-term next steps for us in terms of technology implementation and setting up as an entity within Save the Children to be able to offer the solution to any school development agency where there are these barriers to school participation and student well-being. We've come up um, with action points for ourselves and for our work with the schools and communities in Indonesia and with the global community. We're improving the scope of what WellEco can offer, the scale of what WellEco can offer for other use case scenarios, and also looking at how it can be affordable as a product, and trying also to meet the principles, the unmet principles of the principles for digital development. Thank you.
Thanks so much, Mohini and Max. A great presentation. We're just going to quickly move into the next one, just so that we don't lose too much time and we give Catherine the same opportunity to present. Okay. Catherine, over to you.
Great. Hi, everyone. So this presentation is going from mobile technology to Stone Age paper technology. So yeah, the focus of this one is just this statement at the beginning. It is possible to use low-cost methods to collect accurate, regular data on individual students at risk of dropout in a fragile context. So next slide, please. So Save the Children is delivering a girls' education challenge project that's called Realize, which delivers interventions which aim to increase girls' access to primary and early secondary schools in DRC. So the project works to ensure that marginalised girls in 5 targeted provinces stay in school and demonstrate improved learning outcomes. So when we first started working on the project, there was a very clear recognition that dropout rates for school children in DRC are very high, but we didn't have a good sense of how high they are because any data on attendance is limited and of unknown quality. And I think that's fair to say for quite a few of the countries where we work. So in April 2018, we put together an action research initiative that was specifically to answer this question. Oh, sorry, not ready for next slide yet. So the question is, what are the most effective means of identifying cohort children at risk of dropping out in both formal and non-formal education? And what are the most effective interventions that can successfully prevent dropout? So really we were saying, until we have actual data that tells us accurate attendance and absence rates, we can't actually identify what interventions are needed. So next slide. So came up with three research questions. First of all, I'm trying to identify what's the scale of the problem in the 6 provinces where the project was working. And second of all, what are the best ways of identifying cohort children at risk of dropping out of both formal and non-formal education? So obviously there are different ways of defining best. So we're looking at what are the most economical and efficient ways, and what are the most effective and equitable ways. And then finally, what are the best interventions that can successfully prevent dropout and poor attendance? So that's where we started off. And then next slide. So our research methodology, specifically under this project, was we started with a desk review, and then we did various qualitative surveys, which were participatory workshops and focus groups. And then finally, we did attendance tracking. So like I said, trying to find detailed data at school level on boys and girls who are at risk of school dropout, and just identifying them so that we could then give them assistance. So I'm going to focus on this part of the research for this presentation. So next slide, please. So the attendance tracking, it starts with an absence register that's in an optical mark recognition format. And that's the image in the center of your screen. I think you might be, Americans might be most familiar with this because this is this thing that you normally use for your SATs, I believe. But essentially it's a template where you've got lots of circles and you fill in the circle to denote a yes or no response normally. So the register is completed by the teachers throughout the month. It's collected by field staff and then it's scanned. The scan's then converted to a CSV file, which is then processed using a package in our statistical software that automatically produces project level and school level report. The school level reports shared directly with the schools, and a pre-established referral system for students who are identified at risk of dropout is initiated. So what was nice is when we first did this intervention in the DRC project, they already had lots of interventions designed to help children stay in school. So this was just linking up those interventions with identified individuals. The next slide, please. So this just is to zoom in a little bit. This is what a completed absence register looks like. So you've got the names of the students on the left, and then we've got a code for the school and a code for the class. So you can see this third student was chronically absent. They didn't attend any of the month. That's why all the circles are filled in. Oh, and so just to clarify, we're doing absence registers, not attendance registers, which is a little bit of a mindset issue at the beginning for teachers. But that was what was easier for the software and turned out to be not too problematic after a few months of testing. Next slide, please. So not going into too much detail on the technology, but these are just some screenshots of how it works. So we have the picture of the absence register that then gets, sorry, the image on the far left, that gets run through some OMR software, which produces a CSV. The CSV is then read through the R statistical software, and then you have this beautiful report that's automatically produced on the right in the nice Save the Children format. So just going into a little bit more detail, next slide. So for the pilot in DRC, we started with 15 primary schools, 2,520 students, 45 teachers, 22 school directors, real mix of sizes of schools, and really made life easier on ourselves. Our criteria started for easy access for the field staff, and school directors self-selected to be part of the pilot, and 7 project staff were involved. So moving on, this is what the school level report looks like, and in subsequent testing we realized this is actually still a little bit too complicated. But this report provides information on the quality of data received. So when it says register data available, that means how much of the scanned register could we actually read, the attendance rate, and then gives individual data on which students are at risk of dropping out. So you can see student number 2 had 25 registers, so they've triggered the criteria for total number of absences. They were also absent on consecutive days, so they triggered that one too. And then you can see the other students weren't quite as bad, but they've hit some of our triggers. So moving on, next slide. So the project level report, that requires 3 months of data. And this gives us lots and lots of different analyses, just running through them quickly. So it gives you the number of learners at risk and dropped out by month. It gives you the change in the numbers of students at risk and who dropped out since the previous month. It gives you the absence frequency by month, the attendance frequency by month, the absence frequency by weekday, frequency of number of absences per month, total number of absences, maximum consecutive number of absences, absence frequency by grade, by class size, by institution type, and by institution locality. And I'll talk a bit later about how we've expanded the pilot, but we're also increasing the number of analyses based on requests from different countries. So that's a project level report, and then obviously need some pretty graphs to go with that. So this is just an example of 2 of the graphs that are automatically produced in this report. The first one's the obvious one that we look for. What's the proportion of students at risk and dropped out in a given month? And then the next one's quite an interesting one because you're looking over a long period. So looking at how is attendance frequency changing by month. That's just 2 of the many graphs, and I can't show you them all now. So moving on to the next slide. Obviously we had some challenges. So in DRC, teacher motivation was a big challenge. Volunteering, the notion of volunteering is not an existent in that context, and I think teachers already have a very high workload. So I think that was a challenge. And the time for follow-up. So the registers have to be distributed to the schools, and then meal staff have to pick up the registers once a month. So it relies on the monitoring staff actually having access to the field and having the time to do that. So that was been an issue. There's a delay of 1 month between the schools submitting their registers and getting data on the students at risk of dropout. And that's primarily an access issue, and that's obviously the issue when you're using paper-based systems. The budget for follow-up, as I mentioned, it was in a project that did have existing interventions, but we identified chronic absenteeism and major issues, and there wasn't budget under the project. So it was a bit like we're saying, yes, we're recognizing you're vulnerable, but there's nothing we can do about it. And then also time burden on teachers and staff. If you're not used to collecting data on attendance on a regular basis, it takes out a big chunk of time during the class. And we're working in classes up to 150 students. And then data quality as well. One of the things I really noticed working on this pilot is I think we make a lot of assumptions in head office about the quality of data that we get when we see a project level report. And when you are getting data at an individual level on a monthly basis, it really sheds light on how patchy data quality is. One thing we found in DRC was that the original names we were given for children were nicknames, and that some of them had 4 names and they were getting cut off in the software, and some of them were changing their names during the school year. So all of these things which we would never hear about before because you never look into that degree of detail were all coming up. And then the time frame, yeah, so like I mentioned before, there's a delay of a month between the teachers submitting the data on absence and then them getting back information on students at risk of dropout, which is an issue because they may have been at risk of dropout in January and have actually dropped out in February by the time the teachers get the data. And that's something we're trying to work on. The other issue with using optical mark recognition is obviously the way that the software works is it's a scan of a piece of paper. And so if that paper has any marks on it, or if it's dirty, or if the teacher has accidentally filled in the circle a bit too big, it can mean that the scan isn't read properly. One thing that's just come up in the pilot in Uganda is that the head teacher was very, very proud of having the pilot, and so he put his stamp in 3 different places on the attendance registers and signed it, which meant it was completely unreadable. So so yeah, issues with keeping that register in really good quality have come up. So finally, next step, sorry, next slide please. So as I mentioned before, we started off in DRC. And the reason why I haven't put the results from DRC up is because of some of the challenges that we had with collecting the data. One of the things that I've learned, and I noted down Mahini's point at the beginning about principles for digital development, is start small and scale up, or design for scale up. And in DRC, we had a volunteer developing the OMR software and a consultant working on the analysis. And we were adjusting the software whilst testing and scaling up. And I think we should have probably started a bit slower and on a bit of a smaller scale and possibly not in a high conflict area. Because that caused a lot of challenges, and because of the software updating, we're having to do a lot of historical data cleaning. But putting that to one side, we have scaled up, and we're also piloting in Afghanistan and Uganda now. And that's really interesting. So in DRC, the reason why they wanted to use this approach was because the no mobile phone coverage. In Uganda, it's the same issue, but also incredibly high class sizes, and they're piloting a cash transfers for education and emergencies for the first time under ECHO funding. So they want to collect detailed information on attendance to see if the cash transfers are having any effect. And in Afghanistan, the security situation means that they can't use tablets or smartphones. So really diverse set of contacts all wanting to try this paper-based system for different reasons. So like I mentioned before, we've got various different pieces of software that are used for the project. And so we're making improvements to that. We're going to be looking at being able to do longitudinal analysis at individual level. So looking across school years and additional disaggregation criteria. So if they're receiving a cash transfer, if they're refugee, language of instruction versus home language, that kind of thing. We've also improving our software for register production. And one of my biggest lessons learned doing this was about integrating the SBCC approach during the initial stages of rollout. I think it's another thing in these principles that Mahini was mentioning, that you should be user-led. I think in DRC, the idea originated because we were already doing interventions to bring children back to school, and there'd already been a lot of communication around the need to improve data. But I think overall we had gone in and said, please do this because we're Save the Children, and this will make our lives better and we'll give you more information to help keep children in school. And we were saying that to teachers with the assumption that they would want the children to stay in school longer, and would have the time to collect additional absence and would have the resource to be able to follow up on students. I think there were a lot of assumptions that we made that should probably have been explored in a possibly more sensitive and slow introduction way. So that's something we're really going to look into when we're doing future piloting, is really being a little bit more community led from the outset. And then finally, like Mohini mentioned, we really want to look at next steps. So how do we better integrate child protection and school health referral systems into the approach? We know that these children are at risk of dropping out. What are the reasons coming back from the school directors and the teachers around why they're at risk of dropout, and how can we give them the resources and support them linking to making referrals to existing systems? So yeah, that's the next steps. Thank you.
Thank you so much, Catherine. I really appreciate this. Is a wonderful presentation and very, very honest about both the challenges that we face and different ways that we can, try to address them. I know that we're at time, unfortunately. There were such great presentations. I didn't want to cut in, but there were a number of questions that were actually asked in the chat box. And thank you, Mohini. There were a lot of them more for Waliku, because you guys went first and you addressed, I think, all of them. So I think we're okay on the questions for today. Thank you for your enthusiasm. Thank you for your interest, for everyone who's participated, to our presenters, to our participants, or our attendants. I would say just, in closing, I will send out an updated invitation or for our new webinar, which will be on the 17th of March next month. The topic will be forthcoming, keeping in mind that there's daylight savings time, so it'll be an hour ahead of what we are now. And yours time zone, not in the States, and in the States for, I guess, for our colleagues who are coming from the stateside. Yeah, I think, do you guys want to unmute yourselves and do you want to have any end statements and comments?
Just quickly, Salome, thank you for inviting us, and I look forward to also collaborating with Catherine as we move forward in the coming years to look at the range of solutions that we have. And we're right now in 21 schools, moving to 33, 5,000 kids, and over hundreds, thousands of data points. So we're really in a strong position to do some really good work for kids who are invisible.
Thank you, Mohini. Max, do you have anything to add, Catherine?
No, I agree. Okay. Thank you for having us.
Of course. And just one last thing, the recordings will be placed on the Save the Children Resource Center. So please look forward for that, and I'll post it on Workplace as well. Thank you everyone for your time and participation. I wish you all great evenings, days, afternoons, depending on your time zone. Thanks so much.
You.
All right, bye-bye.
Bye.
Bye-bye. Bye.